Beta-thalassemia is a genetic blood disorder caused by a mutation in the HBB gene on chromosome 11. This gene makes the beta-globin chain, which is an important part of adult hemoglobin protein that carries oxygen in the body. When the HBB gene is mutated, usually by a point or frameshift mutation, the body makes less or none of the beta chain it needs. B-thalassemia is inherited in an autosomal recessive pattern, meaning a person must inherit 2 copies of the faulty gene to have the disease. This also means that if 2 parents who are carriers decide to have a child, each child has a 25% chance of being affected, a 50% chance of being a carrier, and a 25% chance of being unaffected. To understand how B-thalassemia works, it helps to first look at the normal structure of hemoglobin. We have 2 major types of hemoglobin, adult hemoglobin and fetal hemoglobin. Both of them are made up of 4 smaller protein subunits, but the types of subunits are different. In adult hemoglobin, called HbA, the subunits consist of 2 alpha and 2 beta chains. In infants, it consists of 2 alpha and 2 gamma chains. In healthy people, the body keeps an equal balance between the production of alpha and beta chains to form normal hemoglobin. But in B-thalassemia, this balance is lost. Because there is less or no beta chains, we get an extra amount of unused alpha chains. These unstable alpha chains stick together and precipitate, meaning they form clumps inside developing red blood cells and severely damage their membranes. As a result, the RBCs break down early in the bone marrow and spleen, a process called hemolysis. All of this leads to a condition known as anemia, which is when the body does not have enough healthy red blood cells to carry oxygen. The symptoms of B-thalassemia come directly from the chronic anemia it causes. Based on how severe it is, the condition is divided into 3 main types: minor, intermediate, and major. B-thalassemia minor is the mildest form. People with this type are usually healthy and don't have any symptoms, but they are carriers of the condition and can pass it on to their children. B-thalassemia intermedia is a moderate form of the disorder. It causes mild anemia that causes symptoms such as pale skin, weakness, and tiredness that usually appear in early adulthood. B-thalassemia major is the most severe form of these 3. Symptoms here usually appear between 6 and 24 months of age and include severe anemia, which causes extreme tiredness, weakness, and failure to thrive. If the condition worsens and is not treated, more serious symptoms can develop. These can include jaundice, abdominal swelling, and bone deformities, especially in the face, which is sometimes called chipmunk face, and is characterized by prominent cheekbones, an overgrown jaw, and a depressed nasal bridge. Jaundice is when the skin and the whites of the eyes turn yellow, and happens because the breakdown of RBCs releases bilirubin into the blood. The liver and facial bones get bigger because the body tries to make more RBC outside the bone marrow, a process called extramedullary hematopoiesis. Diagnosing beta-thalassemia involves checking the size, number, and content of red blood cells, as well as the types of hemoglobin present. This is first done by performing a regular blood test, which shows low hemoglobin levels. But since low hemoglobin levels can be caused by a range of other conditions, we look at 2 further values. These are a low mean corpuscular volume, which indicates that the patient's red blood cells are smaller than normal, and a high red blood cell distribution width, which shows that the red blood cells are in a lot of different sizes. As a follow-up, a blood smear, a lab test in which blood cells are examined under a microscope, will show small and pale red blood cells, known as hypochromic microcytic. The next important test, which often confirms the diagnosis, is hemoglobin electrophoresis, or HPLC, which separates hemoglobin types by size and charge. The key finding here is that because the beta chains are missing, the body compensates by raising the levels of fetal hemoglobin and a subtype of adult hemoglobin called HbA2. Finally, genetic testing can be performed to identify the exact gene mutation, which is important for offering genetic counseling and assessing risk for offspring. Treatment for B-thalassemia focuses on managing severe anemia and depends on the type a person has. In general, people with the most severe type need the most support. Blood transfusions are usually the first step because they give patients more red blood cells to carry oxygen. However, each transfusion adds a lot of iron to the body, and because the body cannot naturally eliminate excess iron, it builds up in organs like the heart, liver, and endocrine glands, which can cause organ damage and failure, a condition known as hemochromatosis. To prevent this, the next treatment is used, which is called iron chelation therapy. Here, medicines such as deferoxamine are used to remove extra iron from the body. These work by binding to iron and forming a water-soluble complex that can be removed from the body through urine. Additionally, supplementing with folic acid may also be helpful and is often recommended to patients with a milder form of anemia. Finally, a stem cell transplant can be used to treat the most severe cases of this condition. It works by replacing the patient's faulty blood-forming cells with healthy ones from a matching donor, allowing the body to produce normal beta-globin chains.